If you haven't gotten a health care plan for next year, you have until December 7th to enroll for Medicare. And there's another deadline for just more regular insurance. And joining us now this morning to talk about Medicare and common questions concerning health insurance is Craig Gussin from Auerbach and Gussin Insurance and Financial Service. Craig, good to see you. How are you?
Good to see you. I'm doing good, Logan.
Hope you had a good holiday.
I did. You?
Fantastic.
Good.
Just in general, what do people need to know as we move forward concerning health care?
The big thing to know is if you like your plan, you don't have to do a lot. But if you don't, know there's options for you. With Medicare, your Part B is going up $1.50 a month. So it comes right out of your Social Security check. Most people won't even know the difference. Medicare open enrollment ends in 10 days, the 7th of December. So if you like your plan, fine. Check your prescriptions. That's a real big deal for any senior to make sure that your prescriptions are still on the plan you have. And also, if you're taking a new prescription, make sure that one's covered.
Okay.
For individuals who just get health insurance on their own, their deadline is December 15th. So they got somewhere around, 20-some days to get it done. And if they don't sign up by December 15th, they won't have insurance January 1st.
Wow, okay.
And if they sign up after the 15th, then they have until January 15th to sign up to get insurance at all in 2019. So that's a big deal because you cannot buy health insurance after January 15th except for a few qualifying events. So it's really important that they do something. Check your doctors. For individuals, I always tell my clients, tell me the network you're in. Do you use Scripps doctors? Do you use Sharp doctors? Because if they say, hey, I use Sharp doctors, I'm going to say to them, when you go to the doctor, your doctor is normally going to refer you to somebody else in the Sharp network. Why don't you just go with the Sharp HMO plan? We can bring your costs down. Or go with some HMO plans that have the Scripps network. Or if you use Kaiser, go directly to Kaiser. We can help lower your costs because we're seeing rate increases, 8.7% in San Diego County. The Silver plan, which is the most popular plan, Logan, that went up about 3%. But the Bronze plan is the one that really had like 100% rate increase.
So just to be clear, if you like your plan that you're on, can you just do nothing? Or do you still have to do a little bit of research and homework?
Depending, because if you like your plan and you call your doctor's office and they say, yes, we still take it, then the only thing you need to do is decide, okay, if I got it through Covered California and I'm getting a subsidy, which means they're helping to pay for the insurance, Covered California may require you to prove what your income is so you still get the same tax credit.
And starting to sound complicated.
It is, and that's why you want to use an agent. Health insurance agents like myself, we're there to help the consumer. We're like the doctors in the hospitals. We get paid by the insurance companies, not by the consumer. And we're going to look at your situation and help you decide what's best for your needs and how to keep your costs down and make sure you have the right doctor and the right plan, because you also need to think about what's going to happen next year, Logan. You may have a planned hip surgery, knee surgery. Maybe you're a woman having a baby. You need to think about that and say, is this still the best plan for me?
What about copays and deductibles? Are those going to change in 2019 from this year?
We're seeing copays go up or down about $5. Deductibles are going up right around $500, anywhere from $6,000.
A deductible might go up $500
a year
that you wouldn't even know about.
I'm sorry. A deductible would go up very little bit. Your max amount of pocket.
So not a big difference between copay and deductible if you just keep your plan, you like your plan.
The max amount of pocket will go up about $500.
You had mentioned prescription drugs might change even if you stay in the same plan?
Yes, they could, again, depending on your plan. But the most important thing you want to remember is you want to, if it's a generic prescription, you can go into Costco, Vons, Walmart, and say, I'm paying cash. And by doing that,
pay cash at those places, and you can get a better deal.
You and I, Logan, could walk into the same place. Each has the same prescription. You give me your health insurance card and pay $15. I say I'm paying cash and pay $4
versus the $15. Wow, that's terrific.
A month. So the other big thing that everybody wants to know, if you have an individual plan and it's a PPO, and you cover maybe a child who's going to college out of state, there is no out-of-state coverage as of January 1st. For any PPO plan.
So that's a big change for somebody out of state.
Big change, especially for the kid. You might have a kid in college or a family member out of state. So what you're going to want to do is you're going to want to get them a plan in the state that they're now in, because there is no coverage except for emergencies, and that's a tough one because you don't want someone being left
Yeah.
out to dry and out of state.
Is there a way to just lower the cost of your insurance, either what they take out of your paycheck or what you pay a month, kind of just reassess and see if there's a way to shave it a bit?
There is, and that's what you want to work with an agent like myself, any agent in San Diego County who does health insurance, and get them to help you look at the plan, because it may just be as easy as you have a PPO plan, but using a Sharp network. Why don't you just go to Sharp directly?
Sure.
Or you have a Scripps plan. Why don't you just use Scripps, go to an HMO into Scripps, and we can lower your costs a lot. And that's one of the things we're seeing a lot of people do, is once they understand that when they go to the doctor's normally going to refer them to somebody in their network. So why not just lower your costs that way and work on it? And if someone really wants to see a doctor outside the network, they can do that. It might cost them $100. But if they're saving, for one visit, but if they're saving $100 a month in cost, it's worth doing that.
So December 7th is the deadline for the Medicare
Yes.
open enrollment, and then you've got a little bit longer for the individual.
December 15th.
December 15th, so it's really coming up.
Yes.
You've got another week or two. Get it done now is
do.
really the message.
And you
do
can't
some
call,
research.
yeah, and you can't call me up on December 16th and say, hey, can
Right.
you do it? The answer is no. We're tied. It's a law. So, with Medicare, really important to note, 1,000 people a day are turning age 65 in San Diego. I'm sorry, in California.
Yeah.
So if you're going to go on Medicare, you can sign up 3 months before your birthday, the month of your birthday, 3 months after.
Okay.
So if you're going to turn 65, you're going to get a lot of stuff and thing to do. Individual people who have it through Covered California on their own, they got to December 15th to get a January 1 effective date.
Craig Gussin with Auerbach and Gussin Insurance. Good to see you.
Good to see you, Logan.
Thanks so much. Thanks
Thank
for coming
you.
on.